Thanks for joining us for our 7th webinar of 2022 as part of our Patient Ambassador Program. In this webinar, we will tackle some of the biggest myths and misconceptions regarding the donation process. We aim to provide individuals with true facts on organ, eye, and tissue donation and focus on how we can break down these myths in everyday life. Thank you for joining us all. My name is Anna Morgan-Pilardi. I am the Program and Communications Director here at the Chris Klug Foundation, and I will be introducing you to today's panelists and moderating this webinar. I want to take a moment to thank our generous sponsors, Hearts for Us, who make this webinar series possible, as well as this month's Partners Donor Alliance. If you're new to Zoom webinar, you'll notice that we have a Q&A box for you to field questions to the panelists on your console. We will have a brief Q&A at the end, so we encourage you to type your questions as they come to mind. Now I'd like to introduce our panelists for today. Bill Soloway is the president of TRIO, the Transplant Recipients International Organization, for the Philadelphia chapter. He received a life-saving heart transplant in June 2015. Bill has been actively involved in spreading the message of the importance of organ, eye, and tissue donation. He is a volunteer with UNOS, Gift of Life Donor Program, and Help Hope Live. He is also the recipient of the 2022 Chris Klug Foundation Bounce Back Give Back Award. Bill lives in Yardley, Pennsylvania, and enjoys riding his high-wheel bicycle. Thanks for joining us, Bill.
Hey, thanks for having me, Anna.
Wonderful. So then Leanne Skyver. Leanne is a tissue donor coordinator at Donor Alliance. Prior to her time in the donation field, she was an EMT and CNA in Wyoming and Colorado. While working at Swedish Medical Center, she was able to participate in a donor honor walk, which got her interested in the donation field. Leanne also obtained her Certified Tissue Banking Specialist certification, wow, that's a mouthful, in April of 2021 from American Association of Tissue Banks. When she is not working, Leanne enjoys traveling, going to concerts, and getting outside into the beautiful Colorado mountains. Meredith McCurdy is an avid traveler, runner, biker, hiker, yogi, sports marketing professional, and living liver donor. After learning on social media that a childhood friend was looking for a living donor, Meredith raised her hand to learn more. A matching blood type kicked off the journey to a full evaluation, and later Meredith donated 54% of her liver in April of 2021 and both her and her recipient are doing great. Meredith is already back to an active lifestyle and is now a 3-time medalist at the Transplant Games of America, and loves to share the good, great, bad, and the ugly to encourage people to consider sharing their spare parts and register as an organ donor, but ultimately understands that the decision to donate is a serious and deeply personal one. Thank you all for joining us today. I'm super excited to pick your brains on a few different topics. So before we get started, just want to touch on CKF and how we work to eliminate the wait for a transplant. So we are a 501c3 that works nationally across the country, but is based here in Aspen, Colorado. We work to inspire and educate young adults on the importance of becoming an organ donor. CKF uses inspirational stories of those in the transplant community and the educational facts through our toolkit and Donor Dudes programs to educate on the importance of becoming an organ donor. So should we get started? So up first, Leanne, the other day I was talking to a group of high school students, and for the first time I was asked, if I become a donor, will I actually make a difference? Is it true that sometimes they cannot recover any organs or tissues? And how does my becoming a donor help? Could you tell us why it's so important for individuals to say yes?
Absolutely. Well, first and foremost, thank you guys again so much for having me here today. So I want to start with, it's no coincidence that one of our biggest slogans with Donate Life is say yes to giving the gift of life. And it's so important for a variety of reasons to sign up on the registry. The first is it just tells your family, your next of kin, what your wishes are in a very clear and concise way. If you're ever put into a situation where you're unable to express that decision to them, the registry signifies that you've already made that decision for yourself. Now, our statistics do show that over 90% of Americans are supportive of organ and tissue donation. And the reason for people not registering is a variety of reasons. Oftentimes they do feel that they won't be medically or socially acceptable as a donor. And what I would say is, if you just say yes to giving the gift of life, we can take it from there as the professionals that coordinate the donation. So if that is something that you are interested in, and it makes it so much easier for us to have those conversations with your family, if you're put into that situation where you could become a donor. Now, I will say there are circumstances that do make it us unable to move forward with donation. But by you saying yes, we're able to evaluate for that potential, as opposed to, being shut down right from the beginning.
Does anyone else want to add anything to Leanne's answer or any perspective they could bring? No. Awesome. So let's move to Meredith. Often individuals believe that they or their families will be charged if they become a organ or tissue donor. What's your experience with the costs being a living donor? You've been through the process. Can you talk to that?
Sure. So I know we'll talk a little bit later, I think, about kind of the difference between a living donor as well as a donor. We talk about signing up to be a donor in the event that you can give the greatest gift of life in the event of tragedy. In the case of living donation, all of the medical bills are paid by the recipient's insurance, so you won't incur any medical costs. That said, there are additional costs affiliated with these types of medical procedures. So travel costs or lost wages related to both evaluation and then the transplant and recovery process. So it is a consideration. Fortunately, there are organizations who can support you. One is called the National Living Donor Assistance Center, and that organization provides grants to help offset travel costs as well as lost wages. And I was a recipient of such a grant. At the time, I didn't have any short-term disability to help offset the lost wages for my time during recovery, as well as it helped to support travel costs for my parents and my sister who came as caretakers. So there are options out there, and to try to make kind of finances not be a decision maker for a living donor.
And sort of how long did it take you to get back into work and just daily life?
Yeah, so I took 5 weeks off of work. My work is mostly, well, at the time, it was mostly desk job. So I was able to start work again after 5 weeks. And then by 3 months, I was traveling internationally and working at events again, because I was completely kind of back up and running. I would say typically kind of anywhere from 4 to 7 weeks for living donors, depending on how kind of quickly they're feeling up to it again. Oh, actually, sorry, I have one caveat. That specifically, I'm a living liver donor, which is a slightly more invasive surgery than kidney, which is more common. I have seen and spoken to living kidney donors who are back to work much more quickly, as the incisions are a little bit less invasive. So it varies. Sorry. Thanks.
And Leanne, just to touch back with you, so I know you specialize in tissue. Sort of what tissues can we donate as a living recipient, and is there any charge to that as well?
Yeah, so the tissue donation does occur following cardiac time of death. But what we like to stress to our donor families is that there is no cost associated with donation. So we ensure with our funeral home partners, our coroner partners, and our hospital partners that that the family does not incur any additional cost to move forward with donation. In the same token, the family does incur the same cost that they would from a funeral home if they did not move forward with donation, as of course we're unable to cover costs that they would normally incur as well. And as far as organ donation, there is a point in the screening process for an organ donor in the hospital where the organ donor is in an ICU and on a ventilator, and our OPO takes over. There's a certain point where we take over all of the charges moving forward, so that we can, move forward with procuring those organs.
Great, thank you. So Bill, let's jump to sort of another major myth that is, I'm too sick to become an organ donor. You're a transplant recipient. Can you tell us why that is just totally not true?
Yeah, so in fact, I get this question asked a lot. And I just want to say that anyone, regardless of age or medical history, can sign up to be a donor. What happens is the transplant team will determine at your time of death whether donation is possible. So even with an illness, you still may be able to donate your organs or your tissue. And in that same vein, I have people that come up to me and say, but I have cancer, I can't possibly donate anything. Well, and that's not true either, because you can donate your cornea. Your cornea does not have blood flow through it. So even if you have cancer, you can still be a donor. And then we get the one, oh, I'm too old, right? I'm too old to donate. Well, just last year, a veteran from West Virginia donated his liver at the time of his passing at the age of 95, right? We talk about every organ having a superpower. And as Meredith will tell you, the liver superpower is the fact that it regenerates. So here is a hero at the age of 95 donating his liver to save someone else's life at 95 years old. Just incredible.
Really is. I was researching. I'm originally from the UK, for those who don't already know or can't tell. And I was researching the oldest organ donor is actually 107. She was 107 years old and donated her corneas. She's from Scotland. And I was like, that's incredible. Absolutely incredible. So Meredith, a large misconception regarding when you donate is that you can only donate when you're deceased. You prove that's not true by being a living donor. Can you tell us about that process, how it works, and sort of take us step by step through your journey?
Absolutely. I mean, I guess, first of all, how cool is it that you can donate to save someone's life and recover and go on to lead a very happy and full and normal life again? For me, that was the switch that, like, oh, of course. There are things like bone marrow that can be donated, bone marrow and blood, right? We think of often, but also solid organs. So most commonly kidney, a portion of your liver, and less commonly a part of lung, pancreas, or intestines, but I'll mostly talk about liver and kidney, which are the most common. Even at that, they're not that common. So there are thousands of people on the list waiting for organs, and only about 6,500 living organ transplants happened last year, and only about 500 of them were liver. I was one of them. And so the donation process basically starts with finding out someone who needs an organ. So there's two versions. There is what's called directed organ donation and non-directed living organ donation. Directed means that you know the recipient and you are intentionally being evaluated to donate to that person. It's the most common. The non-directed would be that truly an altruistic donation. You're being evaluated to donate to whomever the transplant center, UNOS, the OPO determine are kind of next to receive your organ. Either way, the evaluation is very similar. For liver, it just starts with matching blood type. Matching kidney tissue is a little bit more difficult to match. However, it starts with blood tests. After those blood tests, we go into a couple of days of a variety of exams and tests, potentially procedures, to determine that you as a donor are the healthiest you could ever possibly be. So CT scan, MRI, physical exams. So healthy physically as possibly as you can be. And then want to make sure that you are mentally as healthy as you can be. There's a psychological evaluation as well to ensure that you as a donor understand the risks, understand the surgery, also understand and can make those decisions for yourself. A social worker is also involved to ensure that you are supported financially and humanly, that you have caretakers, that you have support around you. That social worker or potentially another person is also what's called a living donor advocate. And that person holds you as their whole responsibility is to ensure that your best interests are represented to a transplant committee who ultimately makes a decision, as well as to any other healthcare takers, part of the care team going through the process. So once you kind of go through all of these sort of mental and physical wellness and examinations, you determine your top tip. Typically, a transplant center will have a transplant committee who makes an ultimate and final decision about your eligibility. One really important note is, as a living donor, at any point, you can decide that you no longer want to do it. And the only thing communicated is that you are no longer approved, because you're not approved if you don't want to. So super, super important that that it is a decision that is can be life-changing for me in an amazing way. And that decision can change all the way into surgery. And that the care teams are there to ensure that you as a living donor have a successful recovery. Your care team is separate from the recipient's care team for that exact reason, to ensure that your health is the #1 priority among your care team. Oh.
And did you feel any pressures at all when you were going through the process to donate, or was it totally?
I didn't. I have talked to other prospective living donors. So I donated to a friend who we were childhood friends in high school and college. As adults, we are not as close of friends. And I think in some ways that also allowed me to evaluate it very objectively. Whereas I could imagine there would be a sense of pressure if it were a very close family member, the closest friend on the planet, that type of thing. However, I would say that every physician I spoke with, all of the evaluators, they want to ensure that you understand all of the procedure, all of the potential physical risks, of which the risks, frankly, are low, but there are risks with all procedures, as well as what recovery is going to be like. In some ways, I felt like evaluators were trying to talk me out of it so that I was really sure. But I in no way felt any pressure, certainly not from any evaluator. I felt nothing but supported in my decision. And I'm really fortunate that I was supported also by my friends and family to go with whatever decision I made.
Wonderful. Thanks for sharing your story. So Bill, as a transplant recipient, you received the gift of life from a selfless decision of your donor. Could you tell us why it means so much to register as an organ and tissue donor, and how you really actually save a life and you become a hero?
So I have a saying, it's actually the tagline in my email: you have 1 life to live and 8 lives to give. And that is, a healthy organ donor at the time of their passing can save up to 8 people's lives and enhance the lives of 95 people or even more through their tissue, their bone. There's other things that can be used from the body, right? So it's just really important to understand that when you sign up as a donor, you're all in. And, that's so important. As Leanne had mentioned earlier, you talk to people and the general consensus is 95% of the population here in the United States believes in organ donation. But here in Pennsylvania, believe it or not, less than 50% of people sign and check the box on their driver's license to say that they actually want to be an organ donor, which is kind of mind-blowing, right? So it's certainly been a mission of mine, because if my donor didn't say yes to organ donation, I wouldn't be here today, right? So it's just really important to put your money where your mouth is. And if you really believe in organ donation, if your family has been touched through organ donation, it's just really important to sign up and register to be an organ donor. The other thing is, even though you sign up to be an organ donor, doesn't necessarily mean you are going to be an organ donor, right? So the planets almost have to align for the perfect scenario for you to be able to donate your organs. So Leanne, maybe you could help me out here and explain some of that.
Yeah, absolutely, Bill. So the statistics show that about 1.5% of the deaths that occur in our country are actually eligible to be an organ donor. So that is of course a very small margin. And so the more people that say yes to even considering giving that gift is the more chance that we can then move forward with facilitating those gifts to help save somebody else's life.
Great. And, like you were saying, you save 8 lives, you change over 95, but also there's such a bigger change because you change those who surround that person that you're saving their life. Bill, can you talk about what it meant to your family and what they went through supporting you through it, and what somebody else's decision helped with their life?
Yeah, certainly it's the ripple effect, right? Because by saving one life, it certainly affects everybody in their family and so on. It just ripples out, unbelievably so. And, thanks to the gift of life, I'm able to do things that I wasn't able to do. So with my heart, I went into congestive heart failure over a period of time. I'm an avid bicyclist. I wasn't even able to bike, let alone walk 5 steps without getting winded. And I never dreamt that I would ever be back on my bicycle ever again. I just thought, this is it. And what did I have to lose? And then certainly after my heart transplant, 10 weeks later, I'm back on my bike. And now I'm riding 100-mile bike rides, even on the high wheel bike, one of which is in the back here. So to be able to have my life back and do the things that I love and enjoy is just remarkable.
Really is. So let's move to Leanne. Could you explain to the viewers the role of the OPO through the process regarding donation and the transplant side as well? Can you walk us through how the OPO assists?
Yeah, absolutely. So our mission here at Donor Alliance is Donor Alliance saves lives through organ and tissue donation and transplantation. With that being said, myself and our team here, we are, working to facilitate donation 24/7, 365 days a year. We are one of the 52 federally designated organ procurement organizations here in the United States. So our role and our service area covers all of Colorado and then most of Wyoming. And so when a patient is in a hospital in our service area and they have been deemed to have a non-survivable injury, then that is when the hospital contacts us to start evaluating for potential donation. So everything that goes into that are a lot of different testing, different medications that they can give to help promote organ function. It's the conversations that we then have with the families. And then once all of that has been, finished and we're able to move forward with organ matching, so through UNOS and the organ list, the wait list, and the allocation process, then we're able to move forward with going into OR. And with that, on the other end, we also coordinate the tissue or the organ donations that are coming in from other service areas to our area for recipients that are waiting here in our service area. So here in Colorado, we have 4 transplant centers, which are UC Health, University of Colorado Hospital, Children's Hospital, and Porter Adventist Hospital, as well as Presbyterian St. Luke's Medical Center. So we are also in contact with the transplant teams and are working with other organ procurement organizations to bring those organs into our service area to serve our recipients here. I was going to just mention that organs donatable are the heart, liver, kidneys, pancreas, lungs, and intestines. And then as a certified tissue bank, we recover tissue donations following cardiac death. We're referred by EMS agencies, hospitals, coroners, funeral homes, highway patrol agencies as well. And then we do bring our tissue donors to Denver to our specialized surgical facility here and do about 99% of those recoveries here. Now this is going to be very similar process, state to state and OPO to OPO. It might differ a little bit, varying organization to organization, but ultimately, this is typically the same. And the tissue gifts that are able to be donated are heart, and that would be for the valves, as well as skin grafts, bone grafts, corneas, and soft tissue grafts like tendons, ligaments, and veins.
Awesome. So I just had a question in my head and it's popped out. I will loop back to that one. It is gone.
Hey, Anna, I just wanted to tell you, I saw an article that in the UK, they do not have a kidney bank, but they do have a liver pool.
That's a terrible joke.
Okay, so how do everybody here feel the viewers could help eliminate these myths and misconceptions in their daily lives? How do you think that we can go about, as a transplant community, those who are already in the know about what organ donation is, how do you think we can target and promote it across the country?
Interestingly enough, talking about European countries, there are some countries that you actually have to opt out of being an organ donor. My wish is that for the US here, but that would never fly, right? But it's wishful thinking. Really to just be able to break down some of these misconceptions. Some other ones that we didn't even touch on is about, rich or famous people getting priority treatment, right? And talking about the list and having UNOS, United Network for Organ Sharing, right? Some of these things. People talk about, well, it's against my religion, right? So there's a lot of different myths and things that come up that just are that, right? Myths and not fact. So it's really important. Education is the key here, to be able to have everybody do their due diligence. I know for me, it was a no-brainer. When it came time for me to register as an organ donor, I was in scouting. I'm an Eagle Scout. Part of the motto was to help other people at all times. And it was, like I said, a no-brainer for me to check the block and say, hey, what good are my organs going to do me after I die? And if I can help someone else, at least one other person, up to 8 people, right? Why not?
Absolutely. And just to build on that, Bill, with what you were saying about So all major religions do support organ donation. So we do see, some people not being sure of what their religion does support, but with our research, that's what we have determined. And I would echo the education piece, just taking the knowledge, that you learn here today, that you learn from other webinars and other resources, and getting that out into the community, having the conversations with your family to let them know that this is what your decision is, and that you would want the support when that time comes in that decision. I think having these conversations is the biggest step, and it's so important.
And Leanne, I would agree with you on that, right? So just to check off that you're an organ donor and it's on your license is only half the step. The other half of the step is to really let all of your family and friends and relatives know that this is a decision that you thought through and that you made, and that you would like them to honor that request at the time of your passing. Because I've heard so many heartbreaking stories where people said yes to organ donation, and then at the time of their passing, their family didn't know the wishes of their loved one, right? And they were not wanting to let them go, any piece of them go. And they really didn't understand because they weren't educated on the importance of being an organ donor and what that means. So again, as Leanne had mentioned, it's really important to have that conversation. And a lot of times it's not an easy conversation to have, right? But to talk about that and let people know, and maybe through your decision and you explaining it to your family, that somebody else says, hey, that's a good reason. That's why I'm going to become an organ donor.
I think one other thing that's really interesting is you talk about discussing it with your family. Bill, we talked about the effect of your transplant on you and on your family. I think it can also be really important to note that families of deceased donors are often very touched by this gift as well, and they feel as though their loved one carries on and truly gave the ultimate gift. I am, as a teenager, a friend had a tragic ski accident, and her family donated several of her organs and tissues, and I saw how that brought them a smile and joy. I also have become more entrenched in the community. I was participated in the Transplant Games of America, which is a multi-sport, kind of like the Olympics for both recipients and living donors, and then many donor families participate, and sometimes they come with the recipients of their loved ones' organs if they have been connected, and the stories are truly amazing. And I think donation is a way that also can support your family and friends through a challenging grief process.
Very good points, Meredith.
Definitely. There's absolutely a healing aspect to the donation process and pathway, and it might not come right away. They might not have those feelings immediately following the donation, but a few years down the line, we have so many donor families that then come over and they become our advocates for life, which is our volunteer program here at Donor Alliance, and the impact that they feel, and then they're able to pass along to the community. It's truly inspiring to see.
And I'm also a part of the Transplant Games of America on Team Philly. And as Meredith had mentioned, part of our team, not just is living donors and organ recipients, but our donor families. They're our biggest cheerleaders. And I hear so many stories about when they receive letters from their loved ones' recipients on how well they're doing, that they're able to attend a wedding that they normally wouldn't have without that donation, right? And watching kids grow up and grandkids, and just, again, that ripple effect. And just having to know is very therapeutic to the donor families, to know that their loved ones' gift or gifts have made a difference in other people's or families' lives, right?
I have to say, it was my first year at the transplant games this year. And I have never been in a room of so many positive people, like people who have been through hell and back on both sides, transplant and donor. And they are the most positive, most together, most incredible people you've ever met. It really, if you haven't been and you want to, I would 100% go do it. And like we were talking before, communication is key. It's the same in a relationship, you know, you always want to have communication. There's no difference when it comes to organ donation. Make sure you have that conversation. If you want to learn more and you want tools to pass on to friends and family, we have the free educational toolkit. Just go online. It's for anybody and everybody. And it teaches you all about donation, break some of those myths for you as well. So I would like to touch to some of your questions that we've had coming in. First up, let's see, we answered a few of them, so I'm not going to touch back on the ones because we have so many. I do not want to touch back on ones we've already sort of answered. What is the donor swap? Or otherwise known as the pet exchange? Could somebody tell us all about that?
Meredith, do you want to go there, or?
Sure, I can speak to it a little bit, and then Leanne can probably complement some of what I explained. So a paired exchange is most common in kidney donation, where and live-in kidney donation, where a person's a recipient and the person who would like to donate to them their tissues don't match. So they start to kind of make a little zigzag of, okay, I'll donate to this person, and this person's friend will donate to this person, and this person's friend will donate to this person, and this person's friend will donate back to this original person. So it's a bit of a kind of chain of, I would say, kind of paying it forward in a way that then links everyone back again. And I think what's really awesome about it is that the intent to sort of help someone you know as a directed donation actually helps to link, you know, several people to connect donations. As I mentioned briefly, kidney is a little bit harder to match than liver. And so if you find someone who's a willing and excited living donor who is healthy enough to move forward, it can be a great option to support, you know, kind of multiple lives, as well as support your loved one who needs the kidney. Leanne, I don't know if you have something more to add.
No,
Actually,
I would just echo everything that you said, Meredith, and the chain that often forms from those, just the people being willing to help. And it's so inspiring to see everybody banding together and doing, you know, what's best and for the greater good of so many different people involved.
And I just looked it up here. The longest chain just broke 100. So the chain went to 100 people. I have a few good friends. One very close friend who had a kidney, I guess it was 2 years or so ago, and he had a family member that wanted to donate, but they weren't a match. So they ended up donating to someone in Georgia, and then that someone in Georgia donated to someone in Texas, and then that person from Texas donated back to Pennsylvania. So that wasn't as lengthy of a chain, but it is noted that, you know, we talked about OPOs, or organ procurement organizations. There are 57 throughout the country, and the paired exchange program really doesn't start with the OPOs. That is usually the transplant center that they're registered with.
I will say also, if there's anyone out there interested in living kidney donation, and perhaps you don't have someone you want to direct it to, you can kick off one of these chains as a non-directed kidney donor as well.
So that's called altruistic donation, where you actually donate a piece of you to someone you don't even know. So you're basically saying, hey, I know the importance of this, and I'm going to share my spare, right? I have a spare kidney. I'm living a great life, and I'm going to give it to somebody that needs it. And, you know, another misconception is, well, what happens if I donate and then I need an organ, right? So here's the dispelling that myth. You actually go right to the top of the list if ever you need that. And I also have another close friend who was a living kidney donor. Later in life, his kidney gave out, and that's exactly what happened to him. He rocketed right to the top of the list, and he wasn't only just a living donor, but a kidney recipient as well.
Yeah, recently found out that if you donate, you also, not just you jump to the list, you get passes if your child needs a organ, they could actually jump to the list because you made that decision to become a living donor, which is pretty cool too. Awesome. So moving, and I think we just answered a couple of the other questions that were coming in. So can my family be connected with my donor? No, I'm assuming that's meant to be, can my family be connected with my transplant recipient?
So here's how that works. If I can start, and then I know Leanne will jump in. So there's HIPAA regulations, right, to protect the safety of the recipient and the donor family. So in my case, I wanted to reach out to my donor's family to say thank you for the gift. And the process starts by me writing a letter. And that letter then goes to the OPO, who knows who my donor is, not the hospitals, it's the OPOs. And then they send my letter after they read it over and they redact anything out of it that would give me away, like my last name, where I live, email, phone number, all that stuff would be blacked out, right? Then my letter gets put into an envelope, and then another letter is written from the OPO that says, hey, included in this sealed envelope is a letter from your loved one's heart recipient, in my case. And if you choose to read that, it's here for you to read. And I know on occasions people open that up, read it immediately. Other people aren't ready for that, so they just let it go, and some time can go. And on the other side of it, donor families can also write to their recipient, and that goes through the OPO as well. So then after a series of communications go back and forth through the OPO, there's a certain time frame. It's certainly not a couple weeks or a couple months, and a certain number of communications, just not one or two. And then when one of the sides says, hey, I'd like to meet you or communicate with you directly, then the OPO is involved in that. And then they have each party sign a release, and then they put them together with contact information, and then the OPO is out of it.
Yes, that's spot on, Bill. We have what's called an aftercare program, and I believe every OPO does have one. They're the department that does take care of those communications, and just to make sure that everybody on both sides are feeling very comfortable with moving forward in any communication that does occur. In addition to organ donation families communicating, we also have a program set up for the recipients of tissue gifts to be able to send letters, and it works in much of the same way, where the communication all comes through us. And I have, for instance, behind my computer right now, just a sheet of excerpts from different tissue donor recipients back to the donor families, just saying, what a big impact that the gifts have made on their lives, which, inspires me day to day to do what I do. But I know it means the world a lot of the times to the family. But then sometimes, as Bill was saying, they're not ready to have those communications right away. And that's absolutely okay too. And we work very hard to make sure that all of that communication is received in a positive light.
And actually, living donation is somewhat similar. So my living donation was directed to my friend. However, I could have chosen to still be anonymous throughout the entire process if I wanted to be. And I'm sure there are people who make that decision. Either it's a challenging thing, or relationships are tough, or whatever the decision is. But as a living donor, you can also be anonymous to a directed donation. And as a living donor, if it's a non-directed donation, you are anonymous and would go through the same process that Bill and Leanne have just described.
Thank you all. So can a non-US citizen become an organ, eye, and tissue donor? I can answer this. I'm a non-citizen and I'm a donor. Can they be a living donor? I am not sure on that one. I'm going to have to ask if any of you are.
Wouldn't see why not. And here's
Yeah,
something
that's
that I
what I
wanted
was
to share, because we're talking about checking the box on your license to be an organ donor. And as Meredith was talking about, the importance of living donation, and especially the need for kidneys, right? So I'm advocating for several patients now that need a life-saving kidney transplant. They're going to dialysis 3 times a week, or they're doing it at home every night. And it's really disruptive to their life. And depending on where you live, you can wait anywhere from 3 to 7 years to get this gift. But you can fast track that by going out and asking for heroes like Meredith to be a living donor. And one of the things that I wanted to share is I have a lot of people that step forward and say, I would like to be a living donor, and it's not an easy process. You have to go through a lot of examination physically and mentally, right? And in some cases, people actually save their own lives by coming forward to wanting to save somebody else's life. It's not uncommon for someone to say, hey, I want to donate my kidney. They go through the evaluation and testing, and the doctors say, we found this out in the testing, and we wouldn't have had you not come forward for this testing. So, this is a big ask, but it could actually save your own life.
Great. So we're going to jump to a couple of the questions that were pre-sent in, just so we make sure we get a nice rounded answer to everything. Does my race impact my ability to become a donor?
It does not. In short, every race, gender, culture, walk of life can absolutely be an organ, tissue, or eye donor.
Yeah, why would it, right? We all bleed red blood.
Yeah, definitely. And I think that also there's a part of it that we need those in different minorities to become donors, because often they can be a match where others cannot be.
Well, listen, and this is an interesting fact too, right? So I could have gotten the heart from a female. So, look at the genetics and that side of things, right? So we talk about race, we can also talk about sex, right?
Exactly. So another one, I have a family member that does not want to register as an organ, eye, and tissue donor. I am. How do I convince them to become a donor?
I think this, goes back to the education that we were talking about, and how important that is. Ultimately, the decision to donate, it is a big decision, and we want everybody to make that informed decision for themselves, not based off of, potentially what they've seen in movies or TV shows, or from misinformation that floats around, but to really base that decision off of facts. And there are some people that will decide that it's not for them at that point as well. And that's making the best decision for themselves. But the biggest thing is just all of the information, and the real facts, taking that back to them and letting them make the decision based off of that information.
And it's also a frame of mind, right? So you say to that loved one, don't think of organ donation as giving up a part of yourself to keep a total stranger alive. It's really a total stranger giving up almost all of themselves to keep a part of you alive.
And I think it's trying to understand why they've come to that decision, asking them. Start with, why do you feel that way? Because if you can understand why they feel that way, it's a lot easier to then go, well, these are the facts that disprove, or I totally understand, because ultimately it is their decision.
Well, listen, and this is a big one that we didn't even touch on yet, right? If they see I'm a donor at the hospital, they won't try to save my life, right? I'm surprised we haven't had that one come up yet. Well, listen, doctors take the Hippocratic oath, right? First, do no harm. Nurses take the Nightingale pledge. Here are people pledging their lives to help you live, right? Not to take your life. So that's one of the biggest misconceptions that, we come across of, oh, well, once they know I'm an organ donor, they're not going to save my life. That's crazy.
And to touch on that too, Bill, my very best friend, her parents were of that very same frame of mind, and had discouraged her when she signed up, got her driver's license at 16 and signed up to be a donor, attempted to discourage her because they felt that, she gets in a car accident and the EMTs see that she's a registered donor and won't attempt to save her life. And like you were just saying, that's absolutely not the goal of medical professionals in any way. And our organization is only contacted once an injury has been deemed non-survivable, and not before that in any way.
And I would just encourage you, right? Google things, right? Google some of these heartfelt stories that are out there. They may not be in the news mainstream, but they're out there about the guy that received a heart, and the daughter of the father reached out to the recipient and had him walk her down the aisle at her wedding, right? What a cool story. And they're out there. And I think once you can relate to a personal story like that, it alters people's thinking to go, wow, that's pretty dynamic, and I want to be a part of that.
Definitely. So moving on to the next one. Is there any truth behind the organ harvesting scenes you see in movies and shows such as the Squid Games? I want to say immediately no. That is why we have UNOS and the OPOs and a system in place to stop that from ever happening. It does not happen in the US. It is completely illegal.
Yeah, and to that point, right, federal law prohibits buying and selling of organs in the US. In fact, violators can be punished with prison sentences and fines.
Exactly.
The same is true for living donation. So as a donor, I cannot be compensated in any way for my donation. And that's how we keep keep it above board, keep it pure.
Definitely. So moving on. Okay, is it true they may start using organs from pigs for transplants?
So that's already happening. We had 2 news stories the end of last year, beginning of this year, where they're actually raising pigs and genetically altering them for human use. And what I mean by that is that pigs, or in the medical terminology, porcine, which incidentally is where insulin comes from, right, are actually being raised and genetically altered so that we don't get some of the diseases that animals get. In fact, this last one that happened at Johns Hopkins that went on for several weeks, that genetically altered pig was not complete, and they actually died from a disease from animals. So we're moving closer to that, technology, and we're also scrubbing organs free of DNA and injecting stem cells and everything to prevent rejection. So, it's incredible, the modern technology that is happening and what's the future of organ donation. And, right now you can get a pig valve if you have heart problems. So it's been happening, and it's getting closer and closer.
Yeah, we've been doing porcine valves and bovine valves even, for a number of years now. And just wanted to mention that the technology in this field and the research that so many different places are doing they're going to bring huge advancements to the donation field in the future. And I was going to also mention that with scrubbing of DNA, that tissue gifts, that's why they do not require blood matching, DNA matching, because tissue gifts are decellularized and lyophilized to make sure that they're not rejected when a recipient receives them.
Yeah, it's definitely really cool. I read the other day about them starting to make organs and that way. But it's definitely not taking away from the fact that we need to still register as organ and tissue donors. That is ultimately how we're going to help save lives. We're coming up on 5 minutes now, so just want to let everyone know to get those final questions in. We're going to do our best to answer everything. If we do not get to your question, please email it over to info@chrisklugfoundation.org, and we will pass it out to the speakers and get back to you with an answer. So last few questions here. Is the team performing the transplant the same as the team recovering organs from a donor? No.
So I'll answer that from my personal experience, because I met both of my surgeons, the procuring surgeon, which was actually on the other side of town, and the actual surgeon that put my donor's heart in me. So 2 different surgeons, 2 different teams, and that's just for 1 organ. So imagine if they can donate 8 organs, right? It gets pretty crowded in the OR.
I was going to say those ORs can get a little busy.
So can I volunteer / be tested to be a living donor if I do not have health insurance?
That's actually an interesting question. I think it depends on the transplant center. And the answer may be no. And hear me out on this. Partially because of what Bill has just said, where there are so many tests and something can be uncovered. And at that point, you as a patient are responsible for any additional follow-up if a condition is uncovered. But I would say you probably have to ask a transplant center directly about their policies for evaluating living donors.
And that's right, Meredith. So what I would suggest you do is, if you in fact want to become a living donor and you know of somebody that you want to donate to, then you would be in touch with the transplant center for that particular person.
Correct.
Or even if you went to that transplant center and said you wanted to be an altruistic donor, and I'm sure they would handle it from there.
So can children be living donors for their parents or other family members? They can be deceased donors, but can they be living?
I
That's
might
a
defer
good
to Leanne, but
question.
I don't think so. I think you have to be 18.
And again, that would be a check with the transplant center on that, because I know of very rare, and that's on a case-by-case thing.
And this could vary state to state as well. I believe that the minimum age required is 18, at least here in Colorado.
So what support does my family receive after, if I become a donor and pass away? What support is out there for my family?
So talking from the standpoint of the OPO in Philadelphia Gift of Life Donor Program, every year they hold what's known as Celebration of Life ceremonies. This is where we honor your loved one for that precious gift in a ceremony that's done very well. You're invited. We're now doing face-to-face. In fact, there was one last weekend in one area of Pennsylvania. There's one this weekend. You come out. It's a solemn ceremony. There is what's known as a quilting, where they put together these quilts, and you can make a square for your loved one that gets pinned onto this quilt. May have their name, maybe some interests, some hobbies that they're involved in. And you're given a blanket or a prayer shawl, if you will. And there's certainly support from the OPOs, right? So there's a lot of social workers, a lot of people there to help you through this process.
Yes, and similar here as in relation to Pennsylvania, we do 4 donor events every year. One of our biggest is our Donor Dash. That's a 5K through Wash Park, which we were finally able to do again in person this year. And we had a huge turnout. I believe over 10,000 people were in attendance. And then we do a few other events throughout the year as well. At the time of the organ donation, we do different memory making. We'll do a recording of the donor's heartbeat for the family, some sun catchers, some fingerprinting, the quilts as well. And then for tissue donors, we do what are called memory cards, and all of those are, you know, of no charge to the family. And then our aftercare program can assist with grief resources and, you know, further assistance like that too.
Yeah, we love coming to Donor Dash. It's always a fun one for us. And also we run our own patient ambassador program, which is filled with transplant recipients, candidates, donor families, living donors. And we're happy if you reach out to us personally to put you in contact with one of those who might have gone through a similar experience and losing their loved one, and might be able to help you with some of the feelings that come along with that. So last question of the webinar. The OPOs and UNOS aren't really involved when it comes to living donation. Is that correct? Living donation is coordinated only via the transplant center / hospital and other organizations.
That is correct.
So for directed donation, that's correct. Non-directed, I don't actually know for sure. Bill or Leanne, do you know if a non-directed living donation also engages the OPO?
Yeah, so if it's a living donation, it goes strictly through the transplant center. If it is a deceased donation, it goes through the OPO.
And we've done definitely several directed donations from our deceased organ donors. But again, we don't have much play with the living donation at the OPO level.
I guess I meant non-directed for living donation.
I would think, I mean, a UNOS would have to be involved, you know, heavily in
to
that.
Identify the recipient.
Exactly, and the best match. But I do think that would still be transplant center heavy, and that coordination between UNOS and the transplant center. Yeah.
Wonderful. Well, that's all of our questions for today. So I'd like to thank our panelists for joining us, our viewers, and also our sponsors, Hearts for Us, and our partners this month, Donor Alliance. If you'd like to learn more about any of the organizations mentioned, just head to the chat. All the links are there, or reach out to us, as I said before, at info@chrisklugfoundation.org. We're happy to put you in touch with the speakers or those who might be able to help you out with some further questions. And then this recording will be on our website and YouTube and social media. So thank you all and have a wonderful day.